I will try my best to keep this to 10 minutes or less because I know we are under the gun in time. So I want to begin by gratefully acknowledging and giving credit to Drs. Mark and Sarah Redding from Mansfield, Ohio, who have spearheaded much of the work in the development of community health workers in Ohio. They're the co-founders of the Community Health Access Project. Their website is up there, and I understand you all will having access to these PowerPoints later, so you can access that. They also were helped in the development of the first training program for college credit in North Central State Community College. What's new and what's ongoing in Ohio? I talked with Mark on Monday to kind of get the latest. Medicaid managed care companies have begun to contract with programs in Ohio for reimbursement for the work of community health workers for their enrollees. And also that CMS Innovative Practices is doing work to develop on roles for reimbursement under Medicare. Also, Ohio has a community health worker association, which is doing a lot of work on the state level in terms of reimbursement and role development for community health workers. So how did Ohio become one of the states that has accreditation or certification for community health workers? In 2003, the General Assembly passed House Bill 95, which established community health worker certification under the Ohio Board of Nursing. That law became effective in February of 2005. Initially, there was a grandfathered-in clause for those who were currently working as community health workers who did not have to go through a training program if they had an attestation from their employer that they were competent to do the work. That clause has since been rescinded. There's a lot of information up there. This is the rule of law that governs the practice of community health workers, and highlighted at the bottom are chapters 12, 13, and 14, which deal with the standards for community health worker training programs. The Board of Nursing website can be obtained through www.nursing.ohio.gov. If you want to see the rule and law, and it's spelled out, you scroll down on the left side there to rule and law, and then down to the chapter for community health workers, and you can access all of that information. As Sarah said, there are 3 training programs which are approved under the Ohio Board of Nursing. Cincinnati State is one. Also, it's important to highlight that certification is not mandatory in Ohio to be able to practice as a community health worker. The definition of community health workers is written into this Ohio law, and I just would like to highlight that there's roles in education, role modeling, outreach, home visits, and referrals is written in, as well as the board understands and recognizes the unique perspective that community health workers have with working within their communities, and that they are more than able to develop culturally appropriate solutions to the problems that the community is facing. There is one other training program in Ohio that I'm aware of, in Dayton, which is just up the road from Cincinnati. The Center for Healthy Communities has a community health advocate training program. It's not one of the Board of Nursing approved programs, but I understand that it is part of the state board health department approved program, and it's a 6-week introductory course. So the Cincinnati State curriculum is divided into 3 terms. For one of the few centers for higher education is still on terms. Ohio has passed the governor has required that all state colleges go to semesters. So we've been working on semester transition for the last year, and that will start in the fall of 2012. But currently we're still under 3 terms. We have three core community health worker courses, and then there are two additional courses that are generally required for all of the health and public safety students. That's health and wellness promotion and the cultural competency for healthcare providers. So that's written into our curriculum as well. It takes about 27 weeks or 3 terms to complete. Our class size has been kept small with a limit of 12, generally enrolling 9 to 10 students. We've lost 2 to 3 students each cohort. Mostly females have enrolled, but we've had 2 males who have enrolled. Many of our students are in other health and public safety programs and are taking the community health worker training as an add-on certificate. There's a problem when the scheduling for the 2 different programs conflicts, and often the students will stop the CHW training in favor of their other program. So that's one of the issues that we're trying to work out. Faculty, the primary instructor for the core course is the program chair myself. We have had adjuncts to team teaching, but have had difficulty in maintaining the same adjunct over time. So we've had 3 different adjuncts over the last 4 years. And also I referenced the 2 other courses that students are required to take in the curriculum, and those are taught by whatever faculty are teaching the section that the student enrolls in. Those 2 courses are offered online. One has the option of classroom only or online, and the other is only online. We also utilize a great many guest speakers who are experts in their field, who come in and give the students other perspectives, especially when you have one person who's teaching the entire time. The students tend to kind of, tune you out. So it's nice to have other people come in and liven things up a little bit. The competencies that are required by the Board of Nursing, there's generally 10. Healthcare, I'm going to emphasize that a little bit right now because it's a little bit different than what you've heard from the other programs. Because we are under the Board of Nursing, the board requires that they have basic anatomy and physiology. They're trained to do vital signs, understanding substance abuse and effects on health, medical terminology, documentation methods, and then especially signs indicating a change in a client's health status. There's also community resources, which is very common, communication skills, both written and verbal, individual and community advocacy, and then health education. That's really highly emphasized in the program. It's kind of woven throughout the entire curriculum, explaining basic prevention and wellness, explaining age-appropriate safety and injury prevention techniques, and also educating on the adverse health consequences of smoking, alcohol, etc. There's also a heavy emphasis on health in the childbearing years, reproductive health, preconception and interconception health, dealing with adolescent specific health issues and health risks, and some of the special target population group needs, such as kinship caregivers, adults who are taking care of aging parents, and families with disabled adult or child member. And the service skills and responsibilities are woven throughout the entire curriculum: basic clerical, computing skills, confidentiality, HIPAA. Also highlighted are the duties and responsibilities to the board, related to the Board of Nursing's rule and law, and the board does require that an RN teach that specific content, and that the nurse have either attended a CHW training program or has worked with community health workers for 2 years in order to be able to present that information. Our practicum, the board requires 130 hours of clinical practicum time. We leave some of those hours in the first 2 terms. The majority of the time is in the 3rd term. Students are placed into sites with an affiliation agreement with the college. The site agrees to provide a site supervisor, and the students complete a weekly self-reflection, which is an online journal entry, which keeps the instructor connected to what their experience is. Okay. And I'm getting the cutoff. So, let's see. Here's kind of our outcomes. We've enrolled a total of 39 and have graduated about 64%, and about 56% have found jobs as community health workers after completion. So there are much areas for improvement in the roadmap program. And for more information, you can reach me at Cincinnati State. Thank you.